And we are live. If anybody is able to see us, please let me know. If you can hear us properly, let me know in the comments. Let me just check on our community if we are visible. Yes. Hello, tribers. If you can hear us, please let me know in the comments. Hit the like button and let us know if you're looking forward to this session. So, today is a very, very special session and something which was very high on demand for us. So, without much ado, let me just begin with today's session. Today's session is basically on anemia during pregnancy. And for this session, we have with us Dr. Shweta Wazir. Dr. Shweta is an obstetrician and gynecologist at Motherhood Hospital, Gurugram, celebrated for her innovative treatment methods. Her professional repertoire is stippled with roles across the UK and India. During her time in the UK, she served as a specialist registrar at the Queen Elizabeth Hospital, Newcastle. Dr. Wazir is noted for her evidence based approach to natural childbirth. She has significant expertise in high risk pregnancy care, cervical cerclage, hysterectomy, tubectomy, infertility evaluation and treatment, gynecological disorder management, menopausal care, and maternal care. Welcome to the session, Doctor.
Thank you. Thank you so much, Shweta.
Doctor, do you have any opening thoughts for today's session?
Yeah, see, I mean, the topic that you guys have taken, that's like a very important and, uh, fortunately or unfortunately, it's a very common topic and it's a very, very important problem that we face specifically in our country. Now, previously, when we were students, we used to think that anemia is probably a problem that occurs only in the undernourished or, not so privileged class of pregnancy. But over the time, we realized that what is really important is eating the right kind of food. I mean, maybe we are not hand to mouth, but still, it's really important to understand that what kind of food is to be taken in pregnancy, which has the right quantity of vitamins, minerals, irons, protein. So that is why I would say that it is a very important and a very common topic that everybody of us should know before venturing into a pregnancy.
Okay. And doctor, how would you say anemia really affects pregnancy? Because today's topic is specifically about anemia in pregnancy. So could you please shed some light on the effects of anemia while a woman is pregnant?
Yeah. See, first, I would like to explain what anemia is. Now, anemia is when during pregnancy, or maybe in the non pregnant state also, a woman's body is not having sufficient amount of red blood cells that may carry oxygen to your body and to the tissues of your baby. So, what happens is the hemoglobin level of our body goes down. Now, how we define it during the first trimester, a level which is less than 11 is anemia. During the second and third trimester, a level less than 10.5 is anemia. And once you deliver, a level less than 10 is anemia. Why we have different variations is because the iron requirement is variable in different trimesters. So now this is also a myth, that every pregnant woman has to take iron during pregnancy. It's not really important, because we know that it causes gastritis. So that's why I'm giving you these definitions that if you are able to maintain your hemoglobin to that sufficient level, you may not need this medicine at all, right? Now coming to the next part of the question, that how it affects your pregnancy. So, it could be a maternal effect, it could be effect on your baby. Now, if I'm concerned, I'm always concerned more with the mother. So, if it is a maternal effect, what is the most common problem that the woman will have is fatigue. You will always feel that I'm tired. I had a good sleep in the night and I get up in the morning and I'm still very tired. So, that means what? The oxygen carrying capacity of your body is low. That is one, fatigue. Then second, of course, if you look at your eyes, they would be a little pale, they would be whitish or white conjunctiva. You'll have a poor quality of life. You will not be able to work the whole day. Then consequently on the pregnancy, when we deliver you, at that time, the incidence of postpartum hemorrhage, like you bleeding more at the time of delivery is there. And consequently, the incidence of postpartum depression is there. So this is to the mother. To the baby, we could get a low birth weight baby because obviously, the baby is not getting the sufficient amount of blood supply. We could have a preterm delivery. That means you would deliver before your expected due date. And consequently, you will not get a baby which is like so healthy and there would be neonatal problems later on.
Right. Okay. And what are some of the causes for anemia? Is it just poor diet or is it sometimes induced during pregnancy?
Yeah, yeah. See, one is definitely a nutritional deficiency, in which we say the most important cause and the most common is iron deficiency. Okay. Now, apart from that, we do look at folic acid, we do look at vitamin B12. Sometimes vitamin B12 is not properly absorbed in our body. That could be the reason. There could be reasons like some genetic defect in your hemoglobin chain, what we call hemoglobinopathies. To name them, it's called thalassemia, sickle cell anemia. So again, as a routine, we do these tests when you come to the doctor for the first time with your pregnancy. Then there could be some infections which may be causing anemia. There could be some malabsorption syndromes, like for some reason, whatever iron you are taking through your diet or through your medicine is not getting absorbed. Then there could be some chronic diseases like chronic bacteremia or a renal problem, all this kind of stuff, but they would be less common. So what we basically can do during our pregnancy is concentrate on the diet and understand what to take and what not to take during pregnancy.
Okay. And what are the different ways in which a diagnosed anemia can be treated during pregnancy?
Okay, yeah, so the treatment part, see, the first statement is that routine iron recommendation is not there. Like, you are not supposed to take iron routinely in every pregnancy. What we do is when you come for the first time, the booking visit, we check your hemoglobin levels and we recheck again at 28 weeks. And we see, are you fitting into the definition of anemia? Or the other thing is that you may be at a high risk of anemia. Like, say, for example, you may have a low lying placenta, which which does have a tendency that it might bleed during pregnancy. Or you may have a hemoglobinopathy, which may not allow your hemoglobin to rise much. So there are certain conditions where, in that cases, we check your ferritin levels and we see how your iron stores are. And then we think that, okay, should this woman be given iron? Now, once we decide on the iron tablet, the first thing is that we have to give oral iron tablets. We give you a trial of oral iron for 2 weeks, and post the 2 weeks, 2 to 3 weeks, we check, are we getting a response to the oral iron? If we are getting a fair amount of rise in the hemoglobin level, we are satisfied that okay, we are dealing with an iron deficiency anemia. If not, then we start a thorough investigation to find out, is there some other cause that we need to look at to treat this anemia. Now, second thing is we have given oral iron. Of course, along with that, the dietary advice would be given to you that what all things you need to change in your diet so that the iron gets absorbed properly. Now, if we come across a woman who is suppose vomiting, who is having gastritis with iron, then the second option that we have is IV preparations. Like, we don't give you the iron orally, we give it as an intravenous injection. It runs over a span of say 45 minutes or so, and then the rise in the hemoglobin is a little better. And because it is bypassing the stomach and going directly into the bloodstream, you don't have the side effects and the compliance is better. But it is an injection. Okay, so we have to see to it that if possible, we should be going for the oral iron, right? Then, of course, if this doesn't work, we do look at other things. We give you folic acid, we give you vitamin B12 supplementations. And if the anemia happens to be severe, say, I mean that if it is suppose less than 7 and you've crossed 34 weeks, then we might even think of blood transfusion. So that is how step by step we go forward and we think of treating anemia.
Okay. And what are some of the dietary changes that a woman can do to make sure that the iron levels rise in the blood?
Yeah. So, the first thing is you need to understand hemoglobin is always the hemoglobin is always iron plus proteins. So, whenever we need a rise of hemoglobin, we need to increase iron and proteins in our diet. Now, to increase iron, the simple principle you need to remember is anything which is green in color has got iron. Okay, so it could be green leafy vegetables like spinach or any leaves that you get in the market. I mean, suppose it is bok choy leaves, kale leaves. I mean, you get all those leafy vegetables in the market, specifically in winters. So go for all of them. Among the fruits, pomegranate is a very good source of iron. I mean, you can easily have say one or two in a day. Broccolis are good sources of iron. Then go for something like black chana. Then you can have a raw banana. If you think of eating something sweet, jaggery is supposed to be a very good source of iron. Now, this is what all I've quoted up till now. This is what we say non-heme iron. I mean, I'll tell you the difference. The heme iron is something which comes with meat, poultry, chicken, and the non-heme iron is all those what I just told you. The absorption of heme iron is definitely much, much better than a non heme iron. But the problem is that 95% of our diet is covered basically by the non heme iron. So, what we have to do is when we're taking a more or less vegetarian diet and looking at vegetarian sources of iron, we can have vitamin C along with it. That will help in absorption of the iron. Then be careful that you're not taking tea and coffee along with iron tablets because they have got tannins and they inhibit the absorption of iron. Another important thing would be try taking iron early in the morning in empty stomach. The reason being there is a particular enzyme called hepcidin in our body, which if increases, it doesn't allow the release of iron of whatever we have consumed. So naturally, your levels are not going to rise. Then the next thing is that iron and calcium tablets, they've got an interaction with each other. So they don't allow absorption of each other. So they should ideally be taken separately and not together at the same time. Okay, so keeping these things in mind, we would definitely be able to achieve a little rise in hemoglobin day by day if we are taking the tablets properly.
Right. So when you suggested that we take the iron tablets on empty stomach in the morning, does it stand true even for the food that we are consuming to rise our iron levels? Like, does that also need to be
Uh,
consumed on empty
not,
stomach, or
not
it's
really,
okay?
not really, because see, it's not practically possible. But what we do is that we tell you to take the tablets. Now, again, early in the morning, you may be nauseated, you may not feel like taking iron. So, what we say is that take it a little before your main meal. I mean, maybe, when you're hungry, so just take 15, 20 minutes or half an hour prior to that. So the absorption would be better. And the other thing is always take it with something rich in vitamin C. Like, you can take oranges, lemons, sweet limes, or we give you a tablet of vitamin C to be taken along with it to increase the absorption. Okay. But every time it's not practically possible. When you're vomiting and all, you just can't take the iron tablets in the morning. Yeah.
Right. Okay. And some women are not able to tolerate the iron tablets at all. It increases their nausea and the
Yeah.
vomiting feeling that they get.
Okay.
So, are there any ways out of that, or do we have to go
Yeah,
through
yeah.
all of that?
No, 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 not necessarily. See, that is why I'm emphasizing again and again that sometimes we just increase the dose of iron. Number one, we shouldn't routinely supplement it because a woman who's got a hemoglobin of 12, 13, what happens is whenever you take an extra dose of iron, it goes and gets, I mean, it sits in the gastrointestinal tract, and because iron is irritating to the gastrointestinal tract, it initiates that nausea. So the first thing is don't take it routinely. The second thing is now if it is indicated, if your hemoglobin is less, we don't need to go for very high doses. That I mean twice a day, or you're taking like say 100 milligram of elemental iron. That is not needed. Now the studies say, like initially we used to say that 100 to 200 milligram of elemental iron is required. But now we have come down. Our theories have changed. We say that 40 to 80 milligram per day would be good enough, Even somebody who is getting gastritis, we tell them to take on an alternate day basis. Like take today, don't take tomorrow. Give a little rest to the tummy so that whatever extra iron is there in your stomach, that doesn't irritate the, the gastrointestinal tract, and the nausea subsides. Then we definitely, it has to be taken not with a full stomach, because then again it is going to irritate because of the hexidine levels. So these are the things. Then at times we give you a different iron preparation, because uh, every preparation of iron, we've got some salts in it like ferrous fumarate, gluconate, ascorbate. So we need to change the iron preparation to see maybe this particular one could be suiting this patient better, right? So these are the ways how we try. But all said and done, if it doesn't suit you, you don't have to live with it. We say very well, that okay, we try increasing it in your diet, and if it doesn't work, we'll give you an IV preparation. There is no harm in taking an injection. Okay?
Right. Okay. And you said that there has to be a gap between your iron medicine and your calcium medicine. So
Yes.
ideally,
Yes.
what should be the gap between the two?
See, just half an hour is okay. I mean, it doesn't have to be that 8 to 10 hours gap. It's just that it doesn't need to be taken together.
Okay. Okay. So just extending this to new mothers who have just given birth and who are still breastfeeding. So
Mhm.
there is a high chance of anemia occurring in new mothers
Yes,
as well. So
yes,
could you please
yes,
shed some light in
absolutely.
that?
So we call it postpartum anemia. Now, again, after delivery, a woman is too busy and too messed up handling herself, handling the baby. So what really goes for a toss is your diet. Now, in most of the hospitals these days, at the time of discharge, we recruit a dietitian who gives you a proper diet, that what you have to follow once you get discharged. So, my first advice would be please don't take it lightly. Your eating is more important than your feeding the baby. If you are not in a good nutrition, you will not get a good milk supply. So, follow that dietary advice, what the dietitian is telling you. If the hemoglobin is less than 10, then yes, we will have to supplement the iron tablet. Only in that case, we'll be giving you the points to be kept in mind would be the same, that you are taking it in empty stomach, you are taking it with some vitamin C rich, but you have to, kind of remember to take the medicine, otherwise, it would be a problem. And specifically, when this happens is if you've bled a little more in delivery. Like it is said that if you've bled more than 500 ml of blood you've lost during the delivery process, then we need to supplement it. We'll check your hemoglobin in the next 48 hours. And if it is less than 10, we will be giving you iron.
Okay. Are there any points that we've missed out on covering in this session?
Uh, okay, now at the time of delivering, I just want to add one thing that uh, iron deficiency anemia does not influence our mode of delivery, does not influence our timing of delivery. Okay. We should never think that, okay, because I have a complication, I'll land up with a cesarean section. Because I have a complication, I will land up with, at a particular time, I'm going to prematurely terminate your pregnancy. No, that doesn't happen. We will have to handle those problems. And the second important thing is whenever we deliver, we go for an active management of third stage of labor. What is that is we see to it to take some measures so that you don't bleed a lot during the time of delivery. So that's just one small point I wanted my patients to know, right?
Right. Okay. So with that, we are at the end of our questions as well as viewers' questions.
Mm-hmm.
Anything you believe that we've missed out on that should be covered in the scope of this topic?
Uh-huh. Uh, oh, among the symptoms, one important symptom I forgot to tell is something what we say pica. You have a craving to eat non-food items when you are deficient in iron. Okay, so these non-food items are strangely like, at times you want to eat soil. It's called geophagia. Or
Oh,
at times you want to eat ice. You just want to go to the freezer, take out the ice and have it in your mouth. Okay. So it's like these are very peculiar symptoms of iron deficiency, what we call pica. Okay, so this is, and we see practically amongst our patients. So that's one symptom I forgot to tell you guys. Yeah.
okay. That's interesting. I wasn't aware of that. I'm sure our viewers have already had so many takeaways from today's session.
Uh-huh, right.
So Yes. So we've answered all the viewers' questions.
Any
And
questions from the viewers? If we can, I mean, if they have any curiosity of
we
anything.
answered those, like how much of time we should be keeping between the medication. And
Yeah, yeah,
yeah,
yeah.
we did have a few queries. But at the moment, we have answered all of them.
Mm-hmm.
So I'm sure, I think if anybody of you have any queries, please do mention them in the comments. I will email them to doctor after the session and hope we can get an answer.
I can see the comments. Somebody has written, "Does raisins help in the rise of hemoglobin?" Of course, yes. You know, raisins is a very good source of iron, and the other thing is that raisin suppresses your, I mean, want of having sugary things. You know, so raisins and jaggery, these are two things that we do encourage. You know, that you should take it in pregnancy, and it suppresses your nausea also. So that's a very good thing. You can have it.
Okay. And so is dates, I believe. Black raisins or normal ones?
Either ways doesn't make a
Either
difference.
ways. Okay. And vegetarian food, doctor just answered the question about what all vegetarian and non-vegetarian food you can have. Please, after we end the session, you may go back and check out the
One more
answer.
thing is you can take germinated cereals. You know, I mean, those who are vegetarians, germinated cereals and legumes will definitely have more amount of iron than our usual ones. Like, you know, what pulses and all we take, pulses, black chana. If you can just germinate them, again the content of iron rises. So these are ways. See, vegan diet is definitely lesser in iron, but then you can't ask a pregnant woman to convert into a non-vegetarian for this reason. So
Yeah.
we have to work out ways in that way. Okay, so non-heme iron, and you know, honestly speaking, even in the non-vegetarian group, 95% of the diet is still from the non-heme iron. So it's just that we need to keep these points in mind to raise our hemoglobin levels.
Okay. All right. So with that, we are at the end of all the viewers' questions as well. We're already getting a great feedback. Thank you so much, Tribers, for chipping in and letting us know that you loved the session. Thank you so much, Doctor, for taking out your precious time. Just
My
for
pleasure.
everybody to know, Doctor was in a surgery right before this session, and she has taken out time just for us to be here and answer all our queries. So
Mhm.
thank you so much on behalf of all of us for being with
My
us here
pleasure.
today.
My pleasure. It's nice to be here.
I hope we are able to have you again on a different topic and on a different session with us.
Sure, sure. I would be glad to. Thank you.
Thank you so much, all
Right.
the tribers, for tuning in, and stay tuned for more such sessions just with Super Bottoms. Thank you so much.